Namaste to all. Today's my episode is a bit different than the past. I'm in home quarantine at the suggestion and declaration of government Nepal because we are in great crisis and natural disaster which has been prevailing around the world due to new virus called COVID-19 and coronavirus appeared in China post time. So in the regard, I try my best to solve some important message to all common people for the creating awareness. It's my PowerPoint presentation about COVID-19. So COVID-19 information for awareness, CDC, Center for Disease Control Prevention, short CDC. Myself, Homraj Khadga, internet presenter. Likewise, what is COVID-19? Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. The COVID-19 virus spread and primarily through the droplet of saliva. Saliva are discharged from the nose when an infected person coughs or sneezes. So it's important so that you also practice respiratory etiquette, for example, by coughing into flex elbow. The source from World Health Organization, WHO. And know how it spreads. This is the picture. You can get something about the transmission of coronavirus from one person to another. The messages are here. There is currently no vaccine. There is currently no vaccine to prevent coronavirus disease 2019 COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to be spread mainly from person to person between two people who are in close contact with one another within about 6 feet through respiratory droplet produced when an infected person coughs or sneezes. This droplet can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs. This is a process for spreading the coronavirus from one person to another. And take a step to protect yourself. This is the one precaution stage for to be safe from coronavirus infection from person to person. Clean your hands often. Wash your hands often with soaps and water for 20 seconds, especially after you have been in public place or after blowing your nose, coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all the surface of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth, and with unwashed hand. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. This is the picture. It is for keeping in isolation in the pandemic period. Likewise, stay home if you are sick. This is the message: stay home if you are sick, except to get medical care. Don't click on hyperlink. This is the what to do if you are sick. If you click over there, you can find a lot of the information to be safe when you are sick. The person is sitting and lying on bed, I think, and he might have infected from coronavirus, COVID-19. Likewise, cover coughs and sneeze. This is one the picture here. Cover your mouth and nose with tissues when you cough or sneeze, or use them inside your of your elbow. Throw used tissues in trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least for 60% alcohol. And wear face mask if you are sick. This is face mask. If you are sick, you should use face masks when you are near to other people, sharing rooms or vehicles, and before you enter healthcare provider office. If you are not able to wear face mask, for example, because it causes trouble breathing, then you should do your the best to cover your coughs and sneezes. And people who are caring for you should wear face masks if they enter your room. Learn what to do if you are sick. If you click over there, you can find another information. And clean and disinfect. Clean and disinfect the tables, doorknobs, light switches, and countertops, handles, desks, phones, keyboards, toilets, and faucets and sinks. Frequently touch surface. It is kind of information link. If surface doesn't clean them, use detergent, soaps, and water, and prior to disinfection. This is the source from Center for Disease Control and Prevention. A short form is CDC, and www.cdc.gov.